So that is tribal area. Good evening, everyone. We'll start the class. It's already 7:10, and yeah. So I'm Amrita, a PhD student at University of Hyderabad, and I'm a PMRF fellow as well. So we have been discussing through these live interactive sessions from the last 5 weeks, and today is our week 6, right? So yeah, this introduction is for someone who is new to the class, and but I hope no one is new. I hope everyone has been attending the sessions from the start, and yeah, so we here take the I am taking here the live interactive sessions to discuss the previous year assignment questions for the course Maternal Infant Young Child Nutrition, which is taken by Rupal ma'am. So I hope you all have been attending the lectures and you have come prepared to the class for this week. Right, so today we are going to discuss the questions for week 6, and I'll just repeat the rules for the class for someone who is new. um, Please keep yourselves mute for the video as well as audio throughout the class so that we don't have any kind of chaos. And secondly, I will show you a question. You will be given around 5 minutes time for each question to think and answer it properly in the chat box. I'm repeating it, it should be only in the chat box. And yeah, after that, I will tell you what is the correct answer, and if any explanation is needed, I will give you that as well. Okay. And the last thing is, you people should keep noting down how many correct answers and how many wrong answers you are giving. Okay, we'll check your score at the end of the session. Okay, so that's all. So I hope everyone is clear and we will start. Okay, and someone who is have missed the classes, any of the classes from previous weeks, they can go and check the recordings available in my YouTube channel. I hope now all of you have the YouTube links. Already I have uploaded the YouTube videos for the previous 5 weeks. Okay, so yeah, we will start with the first question of today, which is, when the baby opens its mouth widely to breastfeed, where should the baby's upper lip be? At the nipple, at the border of lower areola, at the border of the upper areola, a little above the nipple. Okay, start answering. And there is no hurry. Please read the question properly and give the correct answer. Try to give the correct answer. I am giving you enough time for each question. So let's not hurry and give wrong answers. Okay? Think properly and give. And please do not depend on others' answers. Please give your answer which you feel is confident and correct according to you. Do not depend on others of what they are giving the answer. Okay? It should be solely your option. And whoever is having any doubts, please do not raise the hand, but you can write down your doubts in the chat box. I am seeing the chat box whole time, so I can respond to your doubts as well. Okay. Vaishnavi, you have asked a question and we will get into it. I think it is there in one of the questions, so that time we will know how much breast milk can be kept in the feeding bottle and for how much time. Okay, that question will come as far as I know. Okay, so we'll discuss about that time. So the first question's correct answer is D, a little above the nipple. So here you can see how the baby is attached to the nipple and how uh, the position is there. So this is the correct position where the baby opens its mouth. The baby's upper lip should be a little above the nipple. Okay. Moving on to the next. When the baby opens its mouth widely to breastfeed, where should be the baby's lower lip? At the nipple, at the border of lower areola, at the border of upper areola, above the areola. Start answering. Okay, let's see what is the correct answer to this question. It is B, at the border of the lower areola. As you can see from the picture which I have shown in the previous question as well, the lower lip should be at the low border of the lower areola. This is the lower areola and this is the upper areola. So the upper lip should be near the upper areola and the lower lip should be near the lower areola. Okay, simple. Okay, moving on to the next. In cross cradle hold for breastfeeding, the mother should hold her breast in which shape? From the side in a C-shaped hold, from underneath in a U-shaped hold, from underneath in a scissor-shaped hold, from the side in a scissor-shaped hold. Start answering. It's not so bad. Okay, let's see what is the answer to this question. I think everyone is done. It is B, from underneath in a U-shaped hold. Okay, so here you can see the breastfeeding positions. These are cradle fold, cross cradle fold, football hold, and sideline position. So from here, which is the cross cradle hold? This one. The mother should hold her breast in which shape? From underneath you can see the hand in a scissor shape hold. Here you can see in a scissor shape hold, crossing both the hands. From underneath she has to hold the baby so that it can do proper sucking. Okay, I hope it is clear. Moving on to the next. Which of the following is an early hunger signal of a baby that a mother should look for? Crying, sucking fingers, sleeping, holding breath. Excuse me. People who are joining late, please catch up. And yeah, okay. Let's see what is the correct answer. It is B. Sucking fingers. Which of the following is an early hunger signal of a baby that a mother should look for? It is sucking fingers. So if the baby is sucking fingers, probably it is a signal that it is hungry, right? So how do you know if my baby is hungry? So these are the symptoms which you can see. Signals: licking lips, smacking, sucking sounds, opening a mouth, sticking tongue out, sucking on anything nearby, rooting, that is like turning head and opening the mouth, hand to mouth, fidgeting, squirming, breathing fast, positioning for nursing, fussing, frantic, agitated movements, crying, turning red. These all are cues that your baby is hungry. Okay. Moving on to the next. Which of the following happens during nipple feeding? Nipple gets rubbed onto the hard palate of the baby's mouth. Nipple gets rubbed onto the soft palate of the baby's mouth. Baby latches over the lower areola. Baby gets more milk from the larger milk ducts beneath the areola. Start answering. This is fifth question. Okay, let's see what is the answer to this question. It is nipple gets rubbed onto the hard palate of the baby's mouth. So, what is called nipple feeding? Here you can see if the nipple is getting touched to the hard palate, which is the upper palate of the baby's mouth, then probably it is not sucking the breast milk properly. It is not getting enough breast milk because it is nipple feeding and not breastfeeding. I hope you all are clear with the difference now up to what is nipple feeding and what is breastfeeding. Breastfeeding is when the baby is actually getting enough breast milk when it is sucking, whereas nipple feeding means it is only attached to the nipple but it is unable to suck the breast milk out properly. Okay. Moving on to the next, how wide should the baby open its mouth before the mother puts the breast in it? 30 to 60, 60 to 90 degrees, 90 to 120 degrees, and 120 to 160 degrees. Start answering. So, yeah, I wanted to say that I have been given 2 hours of time to take this session, but generally we finish it in 1 hour or 1.5 an hour max. I don't think it has ever gone to 1.5 an hour. So yeah, but I have been instructed that I should take the class with time given for each and everything. That's why they have allocated me 2 hours. So people who are requesting me that please go a little bit faster, I am really sorry, but that is not possible. I need to give enough time for each question as instructed so that everyone can get the opportunity to answer properly. Okay, so yeah, please try to understand that thing. And I can't finish the class before 1 hour minimum, so that is not possible. Okay, let's see what is the correct answer. I hope everyone is done. It is D, 120 to 160 degrees. So how wide should the baby open its mouth before the mother puts the breast in it? It should be around 120 to 160 degrees. So here you can see the mouth should be open at least 120 degrees to 160 degrees so that he can suck the nipple properly, right? Okay, moving on to the next. If the baby goes to sleep while breastfeeding, how should the mother wake her up? Gently tapping the sole of the baby's feet, moving the baby's head from side to side, telling the baby to wake up, sprinkling water on the baby. Okay, let's see what is the correct answer. It is A. Gently tapping the sole of the baby's feet. So, if the baby slept while breastfeeding, then the mother can wake her up by gently tapping the sole of the feet. Okay. Moving on to the next. When the baby is deeply attached to the breast, which part of the breast will be in the baby's mouth? Only the nipple and the lower areola, whole breast, nipple and the upper areola. Start answering. Okay, let's see what is the answer. It is B. Nipple and lower areola. Already you have seen if the baby is deeply attached to the breast, which part of the breast will be in the baby's mouth? Obviously the nipple and the lower areola. This is the lower areola which is inside almost the baby's mouth, right? So the correct answer is nipple and lower areola. Okay. Moving on to the next. In any breastfeeding hold, the mother's fingers holding the breast should be in which direction? Parallel to the baby's lips, perpendicular to the baby's lips, always in the vertical direction and always in the horizontal direction. Start answering. Everyone is done. No, babies are not allergic to mother's milk, not at all. It is a myth. If you're asking about how much time you can store the baby's milk in fridge, for there is a time limit which we are going to discuss further. But other than that, baby's milk, fresh mother's milk is not allergic to the baby at all. Anyhow, it has antibodies to protect the baby from all the infections. Then how can it be allergic? Okay, let's see what is the correct answer to this question. Yeah, it is A. Parallel to the baby's lips. The mother's fingers holding the breast should be in which direction? In the breastfeeding hold, it should be in parallel to the baby's lips. Okay, moving on to the next. When holding the breast for breastfeeding, the mother's thumb and fingers should always be at what distance from the nipple? Five fingers, one finger, three fingers, or two fingers? Start answering. We are in 10th question. I don't actually remember how many questions we have, but yeah, let's see. Only after 6 months you can start with complementary feeding. We have already discussed it, right? What is exclusive breastfeeding and what is complementary feeding? Only for the first 6 months, the baby should have only breast milk, no powder milk or anything else at all. After 6 months only, you should start with powder milk or any other formula milk, whatever you want to give. But before that, for 6 months, it should be only exclusive breastfeeding. Breastfeeding means only breast milk, nothing else. That is a different case if the child is lactose intolerant. But yeah, I don't think that uh, you need to stop breastfeeding if the baby is lactose intolerant unless it is severe. If you can consult a doctor and if he still prescribes that you can have breast milk, then I think it is possible to have the breast milk if the lactose intolerance is not severe, causing any kind of dehydration or poor growth. Due to breast milk, if the baby is facing any such issues, then yeah, but if you have diagnosed that the baby is having lactose intolerance but still it is able to handle the baby milk, I think it is fine. Breast milk, it is fine. Okay, let's see what is the correct answer for this. It is C. Three fingers. When holding the breast for breastfeeding, the mother's thumb and finger should always be at least 3 fingers distance from the nipple. Okay, otherwise the baby will start sucking the mother's thumb and fingers if it is not having any distance from the nipple. Right. Okay, moving on to the next. The mother is breastfeeding regularly, but the baby is not growing well. Which of the following could be a reason for the baby's poor growth? Mother is feeding very frequently. Mother's milk is not enough. Mother is not feeding both fore milk and hind milk from one breast completely. Mother is not giving formula. Start answering. Okay, just let me quickly see how many questions are still there and how many are. Okay, we have a total of 20 questions. We are in our 12th question, right? Yeah, okay, sorry. Yeah, after 6 months, you can give the baby formula milk, but before 6 months, the baby is not suggested to give formula milk unless it is very lactose intolerant, and it is getting affected by the breast milk. You should not give powder milk. But yeah, if it is that case that the intolerance is severe, that it cannot handle breast milk, then yeah, you have to give powder milk. There is no other option. But unless the doctor recommends that you remove breast milk from the diet, it is not advised that you stop breast milk even if the baby is lactose intolerant. Right? You should consult it with the doctor, and only if the doctor suggests that you should remove it from the diet, because I don't think it is that harmful. Breast milk is that harmful, even if your baby is lactose intolerant. Only in some very severe conditions the breast milk is stopped, otherwise it's not. What is lactose intolerance? Actually, the enzyme which is needed, casein, which is required to digest the milk sugar, is not there, right? That is what is called lactose intolerance, right? But still, the baby's breast the breast the in the breast milk, it is in very whatever form it is, I think it is digestible for the baby. But yeah, if there are some very serious conditions, then you have to consult a doctor. Yeah, please ask. Go ahead. By the time we'll discuss this, see, mother is not feeding both fore milk and hind milk from one breast completely. So the baby mother is breastfeeding, but the baby is not growing well. So the reason could be that the baby mother is not feeding fore milk and hind milk together from one breast completely and then shifting to the another breast. So here you can see what are the different types of breast milk here. Colostrum, we all know it is the first milk secreted from the breast for some days. That is what is called as colostrum, and you can see the color difference as well. Fore milk, it is the mature milk Mature milk is like total milk consists of foremilk and hindmilk. So foremilk is what your baby receives at the beginning of the breastfeeding session. So when the baby starts with a new breastfeeding session, the milk which will come out is called the foremilk. It helps to quench the baby's thirst and contains plenty of lactose and proteins but very little fat and few calories. Right? So after some time, when the foremilk will stop and hind milk will start coming, which is coming at the end of the breastfeeding session, contains more fat and calories. This is required for the baby's overall growth and development, both foremilk as well as hind milk. Therefore, one breast uh, session should be completed totally, then only you should move ahead to the next breast. If your first breast is still giving milk but you stop it in between and shift to the second breast, the baby may not be getting the full nutrition required. Okay, I hope this is clear. Moving on to the next, which of the following is not correct in the position of the baby's body during breastfeeding? Baby's ear, shoulder, and hip should be in the straight line. Baby's stomach should gently press against the mother's chest. Mother must support the baby's entire body. Nair of the baby's nose should be above the mother's nipple. Start answering. Okay, let's see what is the correct answer to this question. It is D. Nair of the baby's nose should be above the mother's nipple. So this is not the correct position for the baby's body during breastfeeding. Here you can see instead of the nose to the nipple, try chin to the skin. It is given here in the picture. So you know that the nair, the tip of the baby's nose should be above the mother's nipple is the wrong position, right? Okay. Moving on to the next question. When are the baby's rapid growth periods in which the mother should breastfeed more often? 1 week, 2 weeks, 4 months, 2 weeks, 6 weeks, 3 months, 3 weeks, 6 weeks, 6 weeks, 6 months, or 3 weeks, 4 weeks, 4 months. Please write down your question in the chat box. That will be better. I can answer it. Is there a question I missed by any chance? Let's check. Seven. It should not be touching the breast. It should be above the breast, right? Obviously, if your nose tip is touching the breast, then how will the baby's mouth touch the nipple, right? It should be above the nipple. Nose should be above the nipple, and the baby's upper lip and lower lip should be attached to the nipple properly, right? Okay. The correct answer to this question is B. 3 weeks, 6 weeks, and 6 months are the baby's rapid growth periods in which the mother should breastfeed more often. Right? Moving on to the next. Which part of the baby should the mother first press into the breast? Baby's nose, baby's chin, baby's forehead, baby's lips. Start answering. Okay, let's see. Previous question, let me show once more. It is B. Sorry, 2 weeks, 6 weeks, and 3 months. It is 2 weeks, 6 weeks, and 3 months where the baby's rapid growth periods are there, and that time the mother should breastfeed them more often. Okay, here the explanation is written as well. I hope it is clear. Yeah, so this answer is baby's chin. So, which part of the baby should the mother first press into the breast? It should be the chin. Here you can see how the mother should hold the baby and how it should push it towards the nipple. So, this is the area where the baby's mouth should go into. So, push base of hand firmly against baby's shoulders, keeping baby, okay, like this. I hope it is clear. Moving on to the next. Your baby's chin is pressed into your breast, and someone who asked where should be the nose, their nose is clear or just touching your breast. It should be up, but it should not touch anywhere, or it should be just touching your breast. But it should not definitely touch the tip of the nipple, right? Okay. Moving on to the next, which of the following options is not a sign that a mother should look for to check whether the baby is deeply attached to the breast? Baby's mouth is wide open and equal part of the areola is seen near the upper and lower lip of the baby. Baby's lower lip is curled in the outward direction. Baby's chin and lips are deeply embedded into the breast. Start answering. Okay, let's see what is the correct answer. It is B. An equal part of the areola is seen near the upper and lower lip of the baby. This is not a sign that mother should look for to check whether the baby is deeply attached to the breast. Okay, other are the correct signs except this one. B is the wrong answer actually. Okay, B is not the sign. Moving on to next. How will the mother know if she should continue feeding the baby from the same breast? If thin watery milk comes out of the breast, or if there is a good flow of thick milk on expression, if 5 drops of thick milk come out on expression, if no milk comes out on expression, if 3 drops of thick milk comes out on expression. Start answering. Okay, let's see what is the correct answer. It is A. If thin watery milk comes out of the breast, which I told you is 4 milk, or if there is a good flow of thick milk on expression, then you should continue feeding the baby from the same breast, right? Okay, moving on to the next. The mother brushes her nipple on the baby's upper lip for more than 10 minutes, but the baby doesn't open its mouth widely. What does it mean? Mother should nipple feed. Mother should forcefully open the baby's mouth. The baby is not hungry. The baby wants formula. Start answering. Okay, I hope everyone is done. Let's see. The correct answer is C. Obviously, if the baby is not opening the mouth, even when the mother is brushing the nipple on her on its upper lip, it means the baby is not hungry now. Okay. Moving on to the next. If dimples appear in the baby's cheeks while breastfeeding, which of the following options is not true? Baby is nipple feeding, more of upper areola is in the baby's mouth, baby's jaw is slowly and distinctly dropping down while swallowing milk, baby is too far from the areola. Start answering. Okay, let's see what is the correct answer to this question. It is C. Baby's jaw is slowly and distinctly dropping down while swallowing milk. Right? If that is the case, then only you will see the baby's cheeks is having dimples while breastfeeding. It means the baby's jaw is slowly going down and it is not swallowing the milk properly. It is probably going down. It is dropping down from its mouth. So you have to check the position of the baby's mouth while breastfeeding every time. Right? Baby is nipple feeding. What should the mother do? Let the baby nipple feed. Put her clean little finger in the baby's mouth to detach and relatch properly. Pull the nipple forcefully from the baby's mouth. Pull the baby's head forcefully away from the breast. Start answering. Whoever is missing the answers or anything, they can please go back and see the recording. The class is being recorded, so no need to worry that much. Okay. Put her clean little finger in the baby's mouth to detach and relatch properly. Okay, if the baby is nipple feeding, then the mother should use the baby's little finger. Put her clean baby's the mother should put her clean little finger in the baby's mouth to detach it and again relatch it properly. If the baby is nipple feeding. Okay. Okay, moving on to the next. What should the mother keep her back straight in the cross cradle hold? To prevent back pain, to decrease milk flow, to increase milk flow, to feed more hind milk. Start answering. Which answer someone is asking to repeat? Let's check. Question number 18 answer. I missed it as I got this. Okay, I will show at the end of the session. Question number 18 again. Okay. Gallop to goats. Okay, I will come to it. Let's see. A. To prevent back pain. So the correct answer for this question is the mother. Why should the mother keep her back straight in cross cattle hold so that it can she can prevent back pain? Okay. Okay. So this was the last question of today's session. So yeah, I am not. Let me clear one more thing that I am not allowed to take any class on any topic. That is not possible because yeah, I am only assigned to discuss these assignment questions with you all so that you can practice the number of more number of questions along with your current year assignment questions. Other than that, if you want any lecture on some topic, you should ask Rupal ma'am to do it. Maybe she will do it for you if required, and if yeah, that is the only thing you can do. Okay. So yeah, I was seeing the scores, 15 out of 20. Okay, someone got 20 out of 20. Very good. Okay, 2 3 people got, I can see, 19 16. Okay, answer your question. I don't know, I missed the question. Maybe after pregnancy, at what time period mother stops producing milk? It depends on how much time the baby is sucking. It around for 2 to 3 years, around 2 years. If the baby, if you're still breastfeeding the baby, the milk will still keep on producing, and after some point of time, after 2 years, yeah, it stops. Okay. What advice to be given to the mother with retracted and flat nipple? Mm, the only advice that can be given is that they should be a little bit more careful in handling the baby or positioning the baby while breastfeeding, because um, there can be more chances that the baby will be doing the nipple feeding instead of properly sucking. So the position is important there, because the nipple is flat and retracted, it is a little bit difficult for the baby to suck onto it as well, right? So the mother has to take care that the baby is sucking the breast milk properly. Ma'am, nose should be at the level of the nipple just at the beginning. Should not be at the level of the nipple, it should be above the nipple in the air. It should not touch anything, or it should just touch the breast. And it should be same throughout. The position of the breastfeeding should be same throughout, right? I missed some questions. 13 out of 20. Correct feeding position. Correct. There are many correct feeding positions as we saw in the first question, right? Let me go back. Four positions we discussed, right? Those are the correct feeding positions, and if you say the correct sucking position, like hold, those are the correct holding positions. Here you can see the breastfeeding positions. These are the cradle hold, cross cradle hold, football hold, and sideline position. These are the positions in which the baby can suck the breastfeed or have the breastfeeding properly. And along with that, you should take care that the baby is attaching to the nipple properly. Here you can see the lower lip should touch the lower areola, upper lip should touch the upper areola, and the nose should not touch anywhere actually. Here you can see that this picture is very clear to remove all your confusion right here. Okay. Nipple feeding means that the baby is not sucking enough milk. Obviously, it is not a good way. It has to be breastfeeding, where your baby is sucking the areola properly. Okay. Nipple feeding means that the baby is not getting enough milk itself. It's just sucking. Although it is sucking, it is not hard. It is not sucking properly. It may not be able to suck enough or sufficient milk required for its growth. Okay, so obviously you may be thinking that it is feeding, but the baby's growth is not proper. That means what? Either it is nipple feeding, or it can be that you are not giving the fore milk and hind milk from one breast properly and shifting to the other breast. These are the two possibilities that mm, correct advice for her by lactation consultant ma'am. How should we know if the baby is taking through the nipple or areola other than facts? How should only through the position you can know if the like you can see in the picture here, right? If the baby's lips are touching the lower areola and and upper areola, and the nipple is totally inside, then obviously it is doing the breastfeeding. If this position is not correct, it may be possible that it is nipple feeding. Okay. Okay, I hope everyone is clear with the doubts. If no one has any more doubts, we will stop here. Uh, the mother can feel that the baby is sucking, but I don't think it is some kind of pressure. All the mothers get acquainted to that feeling over time, right? So, no, it's not any kind of pressure that the mother would be feeling. Yeah, okay. So, we should disperse, or if anyone has any more questions. Okay, if no one has any questions, we will stop here. Correct advice, lactation. I can't understand your question, Santhia. And I'm not some lactation expert as well. So, yeah, actually am unable to understand what question you're trying to ask here. Yeah, if the mother wants to go to the lactation consultant specifically to know how to attach the baby properly to the nipple, then yeah, she can go ahead. After the delivery, the mother while breastfeeding, yeah, that time obviously she is not in her best health. The mother after the delivery, then obviously the mother feels little bit discomfort, because obviously it is a new feeling for her as well to start breastfeeding suddenly. So yes, she feels it, but it is manageable. All the mothers can manage it. And obviously in case of cesarean, the breastfeeding gets delayed a little bit till the mother recovers as well. So, yeah. Normal to feel the pain in the nipples while sucking. Yeah, obviously it is new. Then obviously that if the baby starts, it is new for the baby as well as for the mother. And the baby will also take time to realize in which kind of sucking it is able to suck the most breast milk, and it is obviously going to be little bit pressurizing to the mother to understand how to position the baby so that it is breastfeeding properly and according to her comfort as well. It is normal, completely normal. Yeah, thank you everyone, and we will meet again next Tuesday, 7 o'clock, for our week 7. I hope you all are attending Rupal ma'am's lectures, and keep yourself updated throughout the lecture so that we can have a good discussion here. Okay? Okay, thank you everyone. I will end the class now. Just